My research proposal is about how doxycycline, which is one of the most commonly prescribed medications for acne treatment, affects the gut microbiome in acne patients. There isn't a lot of data out there to date that shows, what's happening to the gut microbiome when you expose patients, repeatedly, several courses of doxycycline over time. Does that have any functional consequences down the road? So that's sort of what I'm trying to investigate in this proposal. So I will be recruiting patients, acne patients who plan to undergo doxycycline, and I'll be profiling their gut microbiome before the treatment, immediately after the treatment, and about a year later to see does the microbiome recover after doxycycline use, or if they don't recover, what does that mean in terms of their functional consequences as an immune dysregulation in the future? Is there any impact on metabolism, obesity, things like that? That would be what I would be studying. There isn't, as I said before, there is not data on doxycycline and looking at acne patients. There are studies that show with other classes of antibiotics that if you expose patients to that there is increase in antibiotic resistance genes in the gut microbiome. So that would be something that I will also be looking at in acne patients who undergo doxycycline. In the future, I'll be looking at if there is gut microbiome changes. We expect that there will be an immediate gut microbiome changes after doxycycline therapy. Pretty much, existing studies show that if you, give patients antibiotics, immediately after the treatment, there's a whole lot of, dysbiosis happening in the gut. The question is whether or not they recover, right, from that, perturbation that was induced by antibiotic therapy. So there are things like probiotics potentially. Is there a role for probiotics if you're starting, antibiotics concurrently with probiotics? Does that, help lessen, that perturbation? Certainly diet could be on one of the things that you can look at. Does the diet, what type of diet that people, have, does that affect their baseline gut microbiome, their resistance to, perturbation by antibiotic therapy, or can it actually modify, how the antibiotic changes the gut microbiome? Physical activities certainly, has an impact on gut microbiome at baseline. So, people who exercise more, does that modify that risk factor? Smoking can also, impact, gut microbiome. So that would be another modifying factor that you can look at. So ultimately, if the study shows that there is a specific bug or a specific set of bugs that are affected by the antibiotic therapy, then is there a way to modify that, use behavioral modification or lifestyle changes or probiotics, to help lessen that effect? Would be a good, good next step study. For me, this research project is one of my passion projects, to be honest with you. It's shocking to me that dermatologists are the number one prescriber of doxycycline. We prescribe more doxycycline than any other, specialty and clinicians. And yet we haven't really studied the effect of what doxycycline does to the gut microbiome. Studies show that antibiotics disturb gut microbiome and can wipe out good bacteria in your gut. And there's certainly mouse data that shows that doxycycline, if you give it to the mice, it will, wipe out. It would basically cause a significant perturbation in the gut microbiome that never returns to baseline, even after you stop doxycycline. And then there are another mouse study that shows that if you give doxycycline to adolescent mice, that there's a long-term effect in liver metabolism and increased adiposity. So this is even more troubling to me, given that we are, our, population who suffer from acne is in teens, right? Like the patients in their teenage years to young adults that were giving several rounds of, doxycycline. And we really haven't studied the long-term impact of doxycycline in these patients. And to sort of look at, so agricultural practice has been like livestock are fed low dose antibiotics for weight gain, and that's been going around for decades, right? Like, so we know what low dose antibiotic does to livestock. It increases, their weight, and we do that to yield more, meat product, right? So there are a lot of studies out there, and certainly in the animal studies that show that there's long-term functional consequences that we have to worry about, yet we haven't really studied that, and we're the number one prescriber of doxycycline. I don't think that this kind of project can be done without funding mechanism like AARS, because you really do need to sort of have a proof of concept studies that show that I can do this kind of study and demonstrate some preliminary data in a small cohort for me to then, conduct a, much larger study. So yeah, without this funding, I think this, project wouldn't be able to get off the ground. So I'm very, very excited that I got it and I could do this. And then, we'll see, what I can show.